Hey guys, can you hear me? I think you can. Awesome. So I'll just wait about 30 seconds. I want to get right into it. Of course, I have too much information. Try to cram it into a smaller time. I'm not going to go 2 hours. I promise I'm not going to go past 1 hour. But this webinar is probably going to be one of the most important ones since I'm going to show you some valuable data on how to really salvage your heart situation and increase your longevity. And even if you have a problem with the heart, we're going to give you a lot of solutions. So, oh, cool. Yeah, everyone can hear me. Awesome. So I'm just going to dive right in there, okay? So I've been playing around with this thing. Hopefully you'll be able to see my slides. And let me just hold them up right now. Okay. Let's see if that works. Yeah, that should work. Okay, cool. Awesome. Perfect. Hey, just to give you a little very quick background of, let me just make sure. Yeah, okay, this is the one I want to show you. About 10 years ago, I had this crazy idea, and I wanted to build a microphone, a heart machine, and I wanted to model it after Dr. Royal Lee's heart monitor. And so back in the 30s, Dr. Royal Lee basically developed a way to take, let me just kind of start from the beginning here because I don't want you to see these. There we go. Let me just start right here. Cool. So I want you to see this one slide right here. This is a microphone. Perfect. Okay. All right, cool. So Dr. Royal Lee, he was a famous nutritionist back in the 30s and 40s and 50s. This guy developed a heart machine back there, and it was a huge machine. It was he had like 10,000 or 20,000 of them out in the community and to doctors, and they were assessing people using the heart machine, heart waves, to measure nutritional deficiencies. So they were able to develop a lot of research in the area of cardiovascular health and nutrition. So here they were out there, you know, evaluating people, telling them what to take for this and that, because the heart is the fastest responding organ to nutrition of anything. So he has all this research. So then in 1963, the FDA came in and pretty much took away his right to, you know, promote nutrition, especially for medical diseases. So he went under probation, and they confiscated all of his research, and they burned it and the whole thing. Well, anyway, there was another guy who saved his research, and he has it available now. And they have a very private, personal library with all of his data that I went to Palmyra, Wisconsin, to see all of his research and to copy it, make copies of it. So I had this crazy idea about 10 years ago of digitizing this heart machine, and I thought, oh, this is a great idea. I'll be able to digitize it, and I can check people, and oh my gosh, this is amazing because the technology now is so much better, blah blah blah. So I've hired acoustic engineers, electrical engineers, programmers from Russia, all over the place. And when we took the microphone apart of this 1935 machine that measures your heart waves, it's called a phonocardiograph, we found that it wasn't a regular microphone. He was using a different technology back then, which just kind of shocked us. And that was, he was using something called earthquake sensing devices. It's called an accelerometer, which just measures very tiny vibrations. So he had an earthquake sensor in his microphone. So then I had to go to a company that sells earthquake sensing devices. it's called an accelerometer. And I had to basically buy this little earthquake sensor and build it into a plastic microphone. So when this microphone attached to your heart, the whole heart goes into sympathetic vibration with the microphone. So you don't have that diaphragm anymore. You have this pure duplication of the heart wave. So I built that, and very expensive. This is the earthquake sensing device right here. We had electrical engineers working on this thing for several years, and we had this really, really cool thing. And then I had to have the software for it. And so we built the software to be able to analyze it. And so that went on for months and months and months and months and months. And so right when we went into the area of FDA approval process, that's where it stopped, because the amount of money it would cost me would just bankrupt me. So I basically have all this stuff in a box in my basement right now, sitting there. So I dropped the project. It was just too expensive. But anyway, I learned a lot from doing this, and I want to share with you a lot of the things that I've learned that I think you're going to like. Okay, so we're going to talk about the cardiovascular system. The cardiovascular system runs on nutrition, just about every single nutrient. But I'm going to talk about the big ones. So I want to make sure you can see me right now. So someone says I can't see anything anymore. Someone says I lost the audio. So just please tell me, can you hear me before I get started? Because the last thing I want to do is get halfway into it and find out. Oh yeah, you can't even hear me. Can you hear me now? Yes, I will make copies of this. There's always a delay, so I have to wait. Okay, cool. All right, everything's fine. All right, so I have to show you this right here. Okay, so let me just go and open this up right here. Share to everyone. Boom. Okay, we're good. All right. So anyway, it was a good experience. Expensive experience. All right, so the first thing I want to talk about is electrolytes. What is an electrolyte? Is it Gatorade? Well, there's only 2 minerals in Gatorade. Electrolytes are electrically charged minerals. They're minerals that when you dissolve them in a fluid, they can conduct electricity. They allow muscles to contract. They allow nerves to send impulses. They allow fluid to travel through the body. So that's what electrolytes are. Like sodium, potassium, calcium, magnesium. We're going to talk about pretty much 4 minerals or electrolytes. Okay, we're not going to talk about all of them, but basically electrolytes are those things that the heart needs to contract, the nerve that goes to the heart to send signals to form a pacemaker, and that's what they're used for. And what they do is they allow things to move back and forth in and out of the cell. Okay. So, for example, most of the sodium is outside the cell. Most of the potassium is inside the cell. So you have this difference that allows, it's called a gradient of electrical charge that flow from one side to another. So we actually can get things moving. All right, so that's what electrolyte is. So, and this is what Gatorade sells. Look at how much sugar, 35 grams of sugar. That has to be milligrams. That can't be grams. That's crazy. They do give you 2 electrolytes, potassium and sodium. So you get potassium, you got 65 milligrams. That's really not the best way to get your electrolytes. It's just pure sugar. Okay, so check this out. We have this heart. We have the muscle of the heart. We have the nerves going to the heart. We have the blood vessels going to the heart. And we're going to talk about all 3 different areas in relationship to what can go wrong and what you can do to prevent and correct these problems. But you can see right here, when these little minerals go, or electrolytes go into the cell, things can move, and other minerals go outside the cell. So that's what actually allows the nerve to conduct. And then look at a muscle. To contract a muscle, you need calcium. Calcium is the main electrolyte that contracts the muscle. Okay, if you ever see your blood pressure, the top number, it's called systolic. That's due to calcium. That's a contraction. The bottom number is due to more relaxation, and that's controlled by magnesium. So you have two different electrolytes. So contraction, all these electrolytes go in and out of the cell, and then something contracts. So here's a heart wave. You can see the contraction and relaxation. Calcium controls the contraction of the muscle. All right? So a lot can go wrong with that. If you have too much calcium or not enough calcium, either there's no contraction or there's too many contractions. They call that fibrillation or tetany, atrial fibrillation. And what I want to tell you, and this is interesting, everyone's concerned about cholesterol for the last 50 years. They're really finding now that coronary calcium is the single best predictor of heart attacks. So you can actually even get a coronary calcium scoring test. It's a CAT scan, and just measures the calcium inside the heart. We'll get into why it's there, but just realize right now, cholesterol is not a really good indicator of heart disease like they say. I will tell you a little bit more about that, but there's actually quite a few studies that show that men and women that have lower cholesterol have more problems with their cardiovascular system. So, but I don't want to create more confusion. It's not really important. And what's important right now is you should understand too much calcium is really bad for the heart, okay? Especially for heart attacks. Why? Because calcium causes the arteries to become stiff and inelastic. So you no longer have the elasticity. And so everything is very rigid. And then the pressure is going to go higher and higher and higher. And then it can blow out an artery, and that's what we call a stroke. Okay? So if you look right here, not only does your arteries calcify, but if you have, there's a huge correlation between calcification of your arteries, which is soft tissue calcium, and osteoporosis. Interesting. So what's happening with a lot of people is calcium is just in the wrong place at the wrong time. Instead of going in the bones, it goes in the soft tissues of the body. So we get kidney stones, gallstones, plaquing of the arteries, tartar on the teeth, bone pain, insomnia, muscle cramps, arrhythmia, high blood pressure, asthma because of the spasm in the bronchial tubes, increased urination, constipation. These are all symptoms of too much calcium. Now, what the heck is the calcium doing in your arteries, right? Well, primarily, one of the reasons it goes in there is that it's acting as a Band-Aid to actually help and patch up something called lesions, or shall we say microhemorrhaging or bleeding, tiny little tears in the arteries. And so calcium and cholesterol go in there to patch it up, to protect you, to help you. So that's really why it's there, because you don't see calcium accumulating or cholesterol randomly. You don't see these accumulating in your veins. They're very specific in areas of high pressure, like the aorta or the coronary, which is around the heart. So what's happening is you get this little lesion or this little tear, which really comes from a vitamin C deficiency, because if you look at vitamin C deficiencies, you get bleeding gums. Well, you'll get bleeding spider veins, varicose veins, and that bleeding is going on all over the body. Okay, so the cholesterol comes in to try to plug it up, the calcium comes in to try to patch it up, and that's really what's behind clogged arteries. So it's a vitamin C deficiency. Calcium is late on the chain, so is cholesterol. Now, doctors like to use calcium channel blockers as the heart medication. And this is interesting. Why would they use calcium channel blockers? Because there's too much calcium in the heart. So it says right here, calcium channel blockers, several medications disrupt the movement of calcium through the calcium channels. It's used for hypertension, decreased blood pressure, and again, stiffness in the arteries, and common causes of elevated systolic. That's the top number. So these have been used slightly more effective than beta blockers, which has to do with blocking another thing which is connected to the adrenal gland, which we'll get into. But they're associated with more side effects. Okay, why? Because you're just treating the symptom. You're not getting rid of the cause. So it's just interesting that they're trying to use a drug to get rid of something that really is a nutritional problem. So as you develop plaque, the first thing that happens is a microhemorrhage, an immune system reaction, and then it signals calcium and cholesterol to start plaquing. That's really the stage of cycle of clogged artery. There's a really high. You go to Amazon.com and you see these books on these great technical books on the body, but they're like $250. They're like $350. So I did a search and I made a little copy of kind of the anatomy of a plaque. And this whole book is about one inch thick, and it talks about what's really the mechanism behind clogged arteries. And it's right here. You can see local microhemorrhage, which basically in the healing process, you have fibrosis, that's scar tissue, and then calcium and cholesterol. That's really the first chain of reaction. So it's a vitamin C deficiency. But you might say, well, I take vitamin C, right? Most people are taking the wrong kind of vitamin C. They're taking something called ascorbic acid. Ascorbic acid is only the eggshell to the egg, the orange pill, the antioxidant portion. The ascorbic acid is really not even vitamin C. It's one tiny portion. It's really there to protect the inside of the vitamin C complex. In nature, vitamin C always comes in complexes, and you're seeing it on the left side right here. And that's really what you need is a whole complex. So I always recommend getting your vitamin C from a food complex. Do not get it synthetically. They make it from ascorbic acid and sulfuric acid and cornstarch, which has no vitamin C. The reason I'm talking about this a little bit longer is because when you take high amounts of ascorbic acid, you actually will start creating this microhemorrhage. So one of the causes of bleeding arteries and gums is taking too much of the wrong thing, ascorbic acid. Okay? So people take grams of this stuff. Now, how do you know? Do you have to get a calcium test? Well, not necessarily. You can look at your other symptoms. Do you tend to get kidney stones, bone pain, abdominal pain, increased urination, depression? These are all just signs of high soft tissue calcium. Ulcers. Isn't it interesting that too much calcium causes ulcers? Look what they give people ulcers. They give them antacids. They give them calcium carbonate, which actually causes an ulcer. Wow, that's interesting. So if you have a lot of stiffness, if you have arthritis, high blood pressure, then you pretty much can suspect you could have some high amounts of calcium in the body that shouldn't be there. All right, and then also if you have low stomach acid, like in heartburn, because heartburn really is a low stomach situation, you will not be able to absorb calcium. Calcium needs to be absorbed in an acid medium. It's kind of like your little faucet outside where you have all the calcium built up. And it then causes a problem with these little specks of calcium. Now, as we're going through this, I want to make sure that you guys don't have any questions. So I'm going to see if you have any questions. And then if you could do me a big favor, if you can tell me what kind of heart problems that you have. Do you have atrial fibrillation? Do you have high blood pressure? Do you have enlarged heart? Just go ahead and let me know. Okay, so Veronica says, if we take vitamin C, should we take vitamin D3, K2 along with it? I'm going to get there. Hang in there. Oh, by the way, at the end of this webinar, I want to give you guys the notes, the summarization of all the nutrition and what it does. You guys want that? So stick with me through the whole thing, and I'll give you the download at the end of the seminar. Okay? So you have everything that I'm talking about. You'll have it downloaded. It's right here. This whole thing, summarized. Okay? All right. So I just wanted to make sure that you guys are with me here. You're not checked out. Okay. A lot of blood pressure. Wow. Okay. Atrial fib. Well, you're going to be glad that you're listening to this because there's things that you can do. Okay. Great. I mean, I'm sorry to hear that, but all right. So let me just open this little guy here. Okay. Cool. Let me just go back here. Okay. What are the risks of soft tissue calcium? 10 times the risk of atrial fib, 5 times the risk of stroke, 3 times heart attack, 5 times blood pressure, 25 times at risk for kidney stones, and 4 times for GERD. So, you know, it's so interesting that the doctor tells us to take calcium in the Centrum Silver. You never, ever, 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 ever want to take something called calcium carbonate. That's the worst thing you can do. And people are taking like 2,000 milligrams of that stuff, especially women after menopause. It's just taking a rock. It's not going to absorb. It's just going to clog up your arteries. And that's not the way to build your bones either. Okay, so now I want to talk about vitamin K2. What is vitamin K2? Vitamin K2 is going to be probably the next superfood, because this vitamin is a recently discovered vitamin. It transports calcium to your bones and your teeth, and it helps make your arteries and joints more elastic. In other words, it transports soft tissue calcium out of the wrong places, out of the arteries. There's even cardiologists that are recommending this to clean out your arteries. This is great for lowering blood pressure. So if you're pregnant, you need to be taking K2. Why? Because the baby will come out with really good teeth, that they won't need braces. They won't have deformed dental structures. They won't have an underbite or an overbite. If you're deficient in K2, you get a Dowager's hump. That's that hump in your back. You shrink in age. So K2 makes your bones really solid. This is the key vitamin that activates bone formation and making your bones really solid. I was taking this when I broke my shoulder and my left elbow in the last 5 years. Okay, so vitamin D, what that does is it helps absorb calcium from the gut into the blood. Okay, so it basically increases the calcium absorption by 20 times from your intestines. But vitamin D does not necessarily push the calcium all the way in the bone. It works with K2, but K2 needs vitamin D3 to be activated. So they both work together. In nature, you will always see them together. Okay, and this is why people say, well, why do I have to take D3 with K2? Well, can't I just take K2? Well, it's just not going to work as effectively. Now, vitamin K1, that has to do with regulating calcium to help you clot, to heal, and you need K1. But K1 has about 8 different proteins, and some of them are anti-clotting, and other ones are clotting, depending what you need. So when people are on warfarin, which is like rat poison, which is for thinning of the blood, boy, that can really throw off their ability to heal. But you do need K1 with K2. I always recommend taking vitamin K in a complex. Take 1 and 2 together with all the factors. So that way you're not missing anything, because they both work together. Okay, K2 is essential for preventing something like this, an underbite, overbite, humpback, cavities, tartar in teeth. I tell you, I wish I would have known about this with my kids. That would have been really, really cool. Even myself, I wish I would have known about this. But okay, so hardening of the arteries, sufficient K2, you don't get calcium deposits in the arteries. Okay, lacking K2, your arteries become stiff. Blood pressure starts kicking in. Some of you are already on K2, and some of you have seen the some of the videos I've done in case studies where I've had patients take K2, and within a matter of 30 to 90 days, you can see a nice reduction of blood pressure and chest pain. It's angina. So when you have too much calcium and too little K2, you get blood pressure, arrhythmias, which are basically your heart's out of rhythm because the electrical, see, that calcium is also accumulating on the nerves as well. And you ever see people that twitch the left eye, or they have like little facial twitches? That's because the calcium is building up on that nerve. Heart attack, strokes, osteoporosis, and osteopenia. Where do you get K2? Grass-fed organic animal products. Pasture-raised, not pasteurized, pasture-raised, like chickens that actually go in the pasture and eat the grass. I always buy organic pasture-raised eggs, not pasteurized eggs. Butter, Kerrygold butter, that's grass-fed kefir. When I was a kid, I craved butter like it was crazy. I would eat a pound of butter in one sitting. Little did I know I was trying to get this darn K2, and I had every single tooth filled with cavities because I ate so much sugar. And I probably would have been protected if I had that much K2, but I didn't know it at the time. I was raised in Wisconsin where they had cows and we had really good butter and everything was cool. But interesting why I craved that butter. That means you're vitamin 2 deficient. You can also, if you're a vegetarian, you can get it in fermented foods such as natto as well. Goose liver, and it's actually in other liver as well. Certain cheeses such as brie and Gouda. Now, isn't it interesting? What are the doctors telling you to do for the last 50 years? Avoid fat, go lean, don't consume fatty foods, stay away from fat. Well, guess what that did? That caused so many problems with the heart, calcification of the heart. That's vitamin D3 and K2 are fat soluble vitamins. You get them from the fat. Now, I want to talk about cholesterol for a second. I know some of you are still kind of stuck on the cholesterol is bad for you, it's going to clog my arteries, but let me just explain something. Your body makes 2,000 milligrams of cholesterol every single day. Yeah, 2,000. It's there to make vitamin D. It's there to make bile, B-I-L-E, to help you absorb nutrients. It's there to make stress hormones. It's there to heal the body. The lens of the eye is fed cholesterol. It's there to make serotonin. Every single cell in your body, almost every cell, makes cholesterol. Interesting. So if your body makes it, why is it so bad? It's the wrong target. It's been the wrong target this whole time. So I'm going to show you something that's quite interesting. And I think I'll be able to show you this right here. Okay, so I have my writing board right here. And the Framingham study, I don't know if I'm going to be able to do this because everything might be backwards, but let's give it a try. I think it is backwards. So if you have high cholesterol, let's say 350, and you have low, say it's 120, what they did is they found 1 out of 100, no, I'm sorry, 1 out of 1,000 people will die of heart attacks with low cholesterol. And they found 2 out of 1,000 will die out of from high cholesterol. So if we go 1 to 2, that's an increase of 100%, right? And that's how they calculate it. You have 100% at risk for getting a heart attack. It sounds pretty scary. But what's wrong with this picture? These are fractions. They're not whole numbers. If we divide these correctly, it's really 0.1% increase. 1/10 of 1% increase. If I told you you have a 1/10 of 1% chance of getting heart attacks, would you take the statins? Would you take the drugs? Probably not. So they have to use a term that it has no legal definition called risk. They'll never say rate, they'll say risk. And by the way, I'm going to get into statins in a little bit. Lipitor, this is amazing. Lipitor, do you know what? You know how much they make? They made over $100 billion. And the only study that showed that it had some positive cholesterol lowering ability showed it was only for men that are high risk. And it said 3 out of 100 people who take Lipitor will have a heart, no, I'm sorry, 3 out of 100 that don't take Lipitor have heart attacks. 2 out of 100 that take Lipitor won't have a heart attack. So they said that's a 33% reduction. So that's 1 out of 100 less. For every 100 people, only one person less will actually not have a heart attack. But this is not death rate, just heart attack. They don't die. But they did find out by taking Lipitor, your overall death rate does go up. The side effect is there's class action. I think there's class action suits right now. Side effects: liver damage, diabetes, memory loss. I mean, it's like unbelievable, unbelievable. So this whole rush of lowering cholesterol. Cholesterol used to be 125. I'm sorry, 225. Now they brought it down to 200, and they put everyone on at high risk. Okay, good. So a lot of you are already trying the K2. Awesome. Okay, good. A lot of questions, but I have to finish this. Someone asked about vitamin F. Yep. I have just so much information. I just have to dive in. What I want to know, is this backwards? This is everything backwards? Can you read it? I mean, I'm looking at it from a different viewpoint, but okay. Let me go back into this. Check this out. Let me just go right here. Yeah, Lipitor, unbelievable. Significantly increasing diabetes. I cannot believe it's still on the market. Side effects. Statin users have a 21% increased risk of death compared to placebo. Oh my gosh. And also, look at this. Statins, over 400% increased risk of serious adverse cardiovascular events, cancer, muscle pain, elevated. See, what I notice when people take Lipitor or statins, they get a lot of pain, joint pain. That's the side effect. Okay, so let's say your cholesterol is really, really high. What can you take? I recommend niacin. Niacin is probably one of the most effective things of lowering cholesterol. But the other thing you're going to have to do is that get the sugar out of the diet. It's the sugar that makes the cholesterol more than eating cholesterol makes your high cholesterol. I consume lots of cheese, lots of egg yolks, lots of fat, and my cholesterol is under 600. No, I'm just kidding. It's probably like 170. I mean, I want it to go up a little higher because that cholesterol actually is there to help make adrenal hormones, and it's not, as long as you're under 225, you're good. But we want to look at the ratios of good and bad cholesterol, which I'll get into. But the point is that you want to get off the sugar, the hidden sugars, if you have high cholesterol, if you want to lower it a little bit. Niacin is a good remedy. It's a B vitamin, B3. Okay, we talked about vitamin D. It helps you absorb calcium in the gut by 20 times, transports calcium from the gut to your blood. It helps activate K2, and it helps lower blood pressure. Okay, that's cool. But why are people deficient in vitamin D? It's mainly because of high levels of cortisol. Cortisol from stress blocks the absorption of vitamin D. Yes, it could be lack of sun. Another cause could be lack of a good gallbladder that produces the bile. Let's say you don't have a gallbladder, chances are you don't have the bile to absorb vitamin D or the other fat soluble vitamins. So you're going to have to take some bile supplement. But bile is necessary to help you absorb all the fat soluble vitamins, vitamin D, K2, vitamin E, and vitamin A. Okay, so now the other thing is high blood pressure, depression, bone pain, loss of bone, low immune system. So cod liver oil. Cod liver oil is a really good way to get a nice balance of vitamin A, vitamin D, but it's what I would recommend, get the virgin cod liver oil, because right now you don't really, I don't really trust a lot of these companies. They could refine it, they add vitamins in there. Virgin cod liver oil is the absolute best. And by the way, the blue ice, the fermented cod liver oil, there's no such thing. You can't ferment an oil. It's just going to go rancid. That's why it tastes so fishy. Yes, I did recommend it in the past, but I was like, wait a second. You can only ferment carbohydrate, not oils. So I don't trust them. Okay, so fatty fish, eggs have vitamin D, dairy, those are all real good sources. Now, vitamin D excess, like if, let's say the doctor gives you 50,000 international units once a week, I think that's an excess, but especially if it's not taken every day, it's just like once a week. But here's the thing, vitamin D excess really is a K2 deficiency. If you take K2, you won't become vitamin D toxic, okay? So when they talk about international units, like for example, 10,000 international units of vitamin D is really 1 milligram. It's not that much, but even 50,000 IUs is not that much. But if you do like 100 or 200,000 IUs of vitamin D without the K2, you're going to get hypercalcemia. That's too much calcium in the arteries. Just because you're loading it up, but you're not taking the K2 to deliver it into the cells. Okay, so anyway, if you know people, friends or family taking D3 by itself, just tell them to take the K2 and they'll be good. We talked about the stages of microhemorrhaging and the vitamin C deficiency. Here's a good anti-soft tissue calcium protocol. I recommend 40,000 IUs of D3, 40,000 IUs, and then 400 micrograms, okay, of K2 it should be. That's a typo. And there's two versions of K2. One version is a MK4, and the other version is a MK7. MK7 is natural. MK4 is synthetic. I use and I recommend the MK7. The one that I sell has vitamin K1 and K2 together, and it's in it's 100 micrograms per tablet or capsule. But you take these together, you take them in the morning with a little bit of Kerrygold butter or with your eggs or with some fat. That's how you take it. And you may need to take it for several months to see the changes depending on how much calcium that you have. Okay, so we're switching gears here. We're going to talk about vitamin E. Vitamin E. Okay, this is interesting. Vitamin E in nature comes in a complex, never as a individual fractionated tocopherol like most people get vitamin E. Most people don't know that synthetic high amounts actually create more problems for people if they take it long term. I mean, I would recommend maybe if you're doing a short detox for like a month, but long term vitamin D has not been shown good on your body. But vitamin E increases the oxygen carrying capacity. It prevents cramping of the heart. It's if you take a look on every single mountaintop that climbers have climbed, these large mountaintops, you will see empty bottles of vitamin E complex because it increases oxygen carrying capacity for high altitudes. So they don't get as sick if they take the vitamin E. So it increases oxygen. So if you don't have vitamin E, your heart will cramp. It's also good for acne, sex organs, menopausal women. Especially after menopause, a lot of women need vitamin E because the pituitary is strained because it now has to, the adrenals have to kick in harder, and then the ovaries aren't working. So the pituitary becomes more deficient in vitamin E because you're not going to need as much vitamin E to run those ovaries anymore. So you see a lot of dry skin, you see heart problems, things like that. Okay, so but WebMD says that vitamin E harms more than it helps. You know, the same website that promotes drugs, right? They're pretty much run by drug companies. Here's the data on that. The studies that show that vitamin E harms you, they've used high potency synthetic tocopherols, alpha tocopherol, which is one little tiny piece of the vitamin E complex in high potencies, but made synthetically. They do not do studies on natural vitamin E, and that's why it comes out bad. So this is a natural vitamin E complex. There's actually 8 tocopherols, alpha, beta, delta, gamma, and it keeps going on and on. Xanthine, selenium, vitamin F1, 2, E2. These are all vitamin E parts of the vitamin E complex. So when you're getting a synthetic tocopherol, you're just getting an eggshell. You're not getting the whole thing. I mean, vitamin E, especially with Dr. Royal Lee's research, I mean, you could take angina and just turn it off within 10 minutes by giving the person vitamin E2 or the vitamin E complex. I had several people come into my office with severe angina, and I load them up with E2, and they do very, very well. Okay, so that's angina, left shoulder pain. But now here's a question: why would you be deficient in vitamin E? Well, it's because it's let's see, I already went through that. Because it's a refined flour disease. It's bleached flour. When they bleach the flour to make breads, pasta, cereal, crackers, biscuits, waffles, pancakes, when you consume the flour products that are bleached, it destroys all the vitamin E in your body. That's why. Chloride bleach. So chlorine is very reactive to vitamin E. It oxidizes vitamin E. So anytime you have a history of eating sugar, refined flour, you're going to create some serious vitamin E complexes, vitamin E deficiencies. And that's really anyone that you know that has angina, they're typically consuming way too much bread, pasta, cereal, things like that. So if you did Ezekiel bread, that probably would be a lot better. Okay, now we're going to switch to another electrolyte called the sodium myth. All right, we talked about calcium, we talked about vitamin D, vitamin K2, and I'm going fast because I just have a lot of data. Sodium, check this out. The risk for death from any cause appeared 24% greater for those consuming lower salts. What? This goes against everything. That's right. Why do we need sodium? Sodium has an RDA, a recommended amount, a requirement of roughly about 2,400 milligrams. That's a teaspoon of sea salt a day. That's how much we need. If you lower your salt intake, you increase your water intake, you dehydrate your cells, and you put lots of stress on the heart. Okay, so low salt diets create a lot of weakness within the heart, and the person may lower the blood pressure a little bit, but the heart suffers because it doesn't have the electrolyte. So all this water drinking without the salt, you're just going to basically dilute the body and cause massive dehydration. And so we need salt. It's not bad. Sea salt is totally fine, but realize when you have sodium chloride, 40% of that is sodium and 60% of it is chloride. So really, it's not necessarily, you can't take like a teaspoon of salt and think you're getting 100% sodium. You're getting only less than half of that is actual sodium, just FYI. And guess what? We need the salt, the chlorides, to build up the stomach acids. If you have a low salt diet, you end up having heartburn because you don't have the raw material to build up the hydrochloric acid. Then you can't absorb the calcium. And then the statins cause the deficiency of all the electrolytes except calcium. So the whole thing is set up to propel or to enhance more heart problems. It's crazy. Okay, diuretics. Diuretics deplete potassium, sodium, magnesium, but they keep the calcium there. Crazy, crazy. So here you are trying to lower your blood pressure, but guess what? You're lowering the electrolytes. That's going to create high blood pressure. See, potassium and magnesium lower blood pressure. They're calming minerals. They relax the body. Calcium increases blood pressure. The other thing is that potassium is necessary to hydrate. If you have high blood pressure, and let's say you want to keep eating salt, and you're craving salt, what you should do is just increase your potassium intake to offset the excess sodium. So let me show you this real fast, because so look at this right here. So we have sodium, and potassium. They work together. You need 4,700 milligrams. You need about 1,000 to 2,300 or 2,400 milligrams. So we need 4 times as much potassium, but what most people do is they consume way too much sodium from the monosodium glutamate in the Chinese food, the junk food, the chips. Like me, I used to have the huge bag of chips. I would have massive amounts of salt. If your adrenals are weak, you need salt as well. So salt is not a bad thing, but you ever notice why sometimes you crave sweet and then you crave salt back and forth? You're trying to get more hydrated. Potassium will help balance the sodium. No one does this. They're heavy here. And so the doctor's saying lower this. No, no, no. We need to increase this. Potassium is what we need to increase. Forget the sodium. That's easy to get from the diet. This is hard to get. Okay, so someone says, what can I do to increase my cholesterol? Start consuming more cholesterol foods. That could bring it, or I wouldn't even worry about it if it's too low. I mean, it really depends if it's really too low. But typically, you want to start consuming more cholesterol to help balance it, because your body will just make more if you actually eat less. All right, so someone says I do 30 kD. So here's the rule of thumb between D3 and K2. It should be 100 micrograms to 10,000 IUs of D3. 100 micrograms of K2 to 10,000 IUs of D3. This is IUs, international units, micrograms of K2. That's the ratio. Now, it could be different from person to person, but that's just a general ratio that you might want to follow. Okay, someone's asking about ghee butter. Yeah, you can do grass-fed ghee all day long. That's totally fine. All right, so let me see here. You guys have a lot of good questions. A lot of these questions are going to be answered as we go through, but I just wanted to show you that one thing there. Okay. Now let's talk about magnesium. Wow, this is a really important mineral in relationship to atrial fibrillation and arrhythmia problems. Magnesium works with calcium. Magnesium cleans out the receptor for calcium, when the heart contracts, magnesium cleans out the calcium so it can relax. If you can't relax, if your muscles can't let go, you need magnesium. Of course, you need potassium as well, but magnesium is a really key mineral. I do not recommend magnesium oxide. You can do the magnesium pico, which is a very small amounts. But honestly, I'll show you where I like to get my magnesium from food. I'll tell you what food has the highest in a bit. But check this out. Magnesium is the major electrolyte in the heart. It controls the heartbeat in the relaxation phase. It works closely with calcium and potassium, but it's considered a natural channel, calcium channel blocker. So what they really should do is just give you the magnesium instead of the calcium channel blocker, especially for blood pressure. The highest concentrations of magnesium are in your left ventricle in your heart. Interesting. So this is what happens. The contraction of the heartbeat, the relaxation of the magnesium. Calcium and magnesium working together. If you're deficient, you get arrhythmias, rapid heartbeat, stiff arteries, because magnesium will help lower calcium. High blood pressure, angina, excessive calcium, mitral valve prolapse, overactive stress hormones. I mean, think about how many people have these problems. So a lot of these nutrients tend to cross over and help other problems. It's not just like if you're deficient in magnesium, you need this. You need kind of all the electrolytes in the right amounts. Now, if you wanted to, here's people always want to say, well, I want to go do a test. Well, first of all, doctors never ever test magnesium. And even if they do, like these electrolytes aren't always in the blood, they're in the cells. So rarely do they show up. And even your body will pull minerals from your bone to keep your blood normal. So it's not always the best way to assess. If you wanted to check your magnesium, get a magnesium red blood cell test. Okay, you can get them online and test it if you wanted to test it. Okay, so check this out. This is fascinating. Chlorophyll. Chlorophyll is the green of the plant. Magnesium is in leafy greens, okay? That's where you get it because it's the main mineral in chlorophyll. Wow, that's cool. So it's actually green. So it gives you, or actually reflects green. It doesn't absorb all the other colors, so it reflects green, so it becomes green. So chlorophyll is how you get the magnesium. And yes, I get it from my wheatgrass juice powder. It's raw, organic, unheated, grown on an ancient seedbed, so you have all the trace minerals with massive amounts of magnesium. It has a very calming effect. It's wonderful for the heart. It's 100% absorbable. So that's how I get my magnesium. I'll always take my wheatgrass with the K2 and D3 together, and I really, if I don't take them together, doesn't feel as good. But chlorophyll. Okay, let's shift our gears to potassium real fast. Potassium deficiency. Interesting. The potassium controls the heart rate. Okay? If you're deficient in potassium, you'll have a high pulse rate. And you will also have a labored heartbeat, a strong heartbeat that you will be able to hear in your inner ear when you put your head on the pillow. Potassium becomes depleted after a heavy carbohydrate meal. Okay? I think I told you guys the story when I was getting married and we're out looking for, this is 25 years ago, I was looking for wedding cakes. And so we find this Italian restaurant and they were closing up. And this is after having a pizza. I had the bread, I had this dessert, I had the wine, I had all this carbohydrate, right? And then they're going to shoot out all these desserts. We're the last people there. So, of course, I couldn't see that go to waste. So I said, hey, hold on, bring that over here. And we started eating all these samples of all these cakes. I remember driving home and I noticed, I'm like, I don't feel right. I feel incredibly thirsty right now. I did not sleep one little minute. My heart was beating. That's because it created a potassium deficiency. So in other words, carbohydrates, refined carbohydrates, are very bad for potassium. All right, so potassium controls the heart rate. I saw this online. I just thought this was kind of funny. Someone was making a comment on, might have been Yahoo or something. It says, I've done a little bit of research. I've done a little bit of Googling and searching nutrition textbooks, and I haven't been able to find the sources that explain how RDAs for potassium got to be so much more than any person normally eats. That is so funny. Well, that's because no one eats what they need. It says right here, the RDAs imply that there would be some benefit to reaching the target or some elevated risk of falling short of it. Does anyone know what research it was that led to the recommendation? Listen, we don't form our recommended RDAs based on what the population eats, okay? That's really bad. We want to eat what we're recommended to eat, like from certain nutrient requirements. So this is what you'd have to do. You'd have to have like 8 bananas, 5 avocados to get your potassium. It's very difficult to get potassium because bananas only has like 300 milligrams. You need 4,700. Avocados have 800 milligrams. So where do you get your potassium? Right there. Salad, leafy greens. Because you know why? Because you'll get the magnesium as well. You'll get the potassium, magnesium, you'll get even sodium. In nature, sodium always comes a little bit lower in vegetables, but that's why we have salt, sea salt. So what should you do? You really need to start increasing your vegetables. Why? Because the pills, if you take potassium pills and magnesium pills, those are individual, called elemental minerals. They're not in the right combinations always, and it's really hard to know how much you have to take. It's much better if you have the food or a food concentrate. So you need bigger salads. If I had a heart problem, if I had high blood pressure, I would be consuming no less than 10 cups of salad every single day. And make sure the lettuce is really high quality. Make sure it's good. If you want spinach, that's totally fine. But that's how you want to start to reverse this heart problem. Okay, we're switching gears. Vitamin B complex. Now, how many of you have ever heard of vitamin B4 before? That sounded kind of weird. Well, as you already know, the first B vitamin that was ever discovered is B1, right? And then it goes B2, 3, and then what? 5 and 6, and 8 and 10, and 12. There's actually a vitamin B4. You can look it up, and B4 is an amazing nerve conduction vitamin that helps snap the heart back into tone. It helps the tone of the heart. It's wonderful for fibrillation, and it's wonderful for an enlarged heart. When the heart becomes deficient in vitamin B4, it starts to sag and droop, and it loses tone. And that's called an enlarged heart, or cardiomegaly. And then what happens, the valves don't close like they should because they are now stretched out, and then you get murmurs. So B vitamin deficiencies create murmurs. And a couple sources of B vitamins. You can get it from nutritional yeast, which, by the way, is kind of half of. I have a nutritional yeast product that's called Adrenal Day Formula because half of it is nutritional yeast, but it's no synthetics. It's very difficult to get nutritional yeast without having it fortified with synthetics. But guess what else has the B complex, including B4? Wheatgrass juice powder, or wheatgrass. It contains most all of the B complex, which is very cool because it has the magnesium, the vitamin C. It has it doesn't have the K2, but it has all the electrolytes. Okay, so that's the B4 complex. Now, how do you become deficient in B4? By consuming too many refined flour products, and sugar. And that's why they enrich all the flour products with B vitamins, by the way, because when they refine the food, they deplete the B vitamins. When I was doing all this research with the heart machine, you could see some serious, when you get people like the B complex, you could see changes within 10 minutes on the heartbeats. Of course, I'm not going to make any claims because the cardiovascular industry is highly suppressive with anything alternative. So here's my disclaimer. All this information is educational. It's for your entertainment. Before you apply any of this, see your doctor. I'm not making any claims that any of this will cure you of any diseases, okay? That's my disclaimer. Okay, let's go to coronary constriction. Now, the coronary artery is the artery that surrounds the heart. And a lot of times it gets constricted and it tightens up and it goes in a spasm. And that's because the person is running out of adrenal hormones. When the adrenal gland becomes weakened, there's two things that happen. The blood pressure goes up, but the coronary artery gets constricted, and the lung becomes constricted. So you have like a constricted lung, asthma, and then you have heart problems, angina. So if you have coronary heart constriction or spasm, or bronchial stuff or asthma, I'm going to recommend you support the adrenal gland. And again, I have a lot of different products for that, but I recommend the new one for that, which is it's called cortisol support formula. It's some seriously powerful support to any chronic inflammatory problems, but for the heart, it's really good, especially if you have like a spasm, like that. Okay, so check this out. So if we have a muscular problem, we have the muscle cramp, low vitamin E2, antispasm, coronary, it's adrenal, arrhythmias is low magnesium, low potassium, high calcium, low pulse rate is low potassium. I'm sorry, high pulse rate is low potassium. Low pulse rate is low adrenals or low salt. Valvular problems, murmurs, or B vitamin deficiencies. Vascular clogged arteries is low K2, low vitamin C. Blood pressure, low potassium, high sodium. So if we just kind of scan, like let's look at this for a second. You got all these electrolytes, right? And you got these B vitamins. There's a common thread here. You have to eat more vegetable, definitely sea salt, leafy greens. But look at, you need more fat. You need more grass-fed fat. That's what people are missing. The combination of the grass-fed meats or the fat and the vegetable it'd be the perfect diet for the heart. But guess what healthcare says? Avoid fat, eggs, butter, salt. 60% of your diet, whole grains. Drink 2 glasses of wine. Take your Lipitor diuretics. Take your calcium channel blocker, synthetic vitamins. There's no difference. Drink all your water. Take your vitamin D without K2. And if it doesn't show up on a test, you're fine. I mean, it's outrageous. It's just basically, honestly, from my viewpoint, it's the biggest scam on the planet right now. There's no health in healthcare. It's missing. Now, there are some hidden little things that you could run into if you're taking these fat-soluble vitamins. If you don't have a gallbladder, or if you have low bile, you won't be able to absorb the fat-soluble vitamins. So in that case, I recommend the gallbladder formula because that will help you absorb it. And also, if your stomach has low acids, and how do you know if you have low stomach acids? Well, if you eat and you get indigestion, or if you get heartburn or acid reflux, then you need more acid. That means that you're not going to pull the minerals in. So your muscles are going to be all spasmodic and hard, and your heart's going to suffer because of it. Real quickly, the liver. The liver is the backup chamber, like a sponge for the heart. And if the liver is bad, it won't be able to back up the heart as much. In that case, it puts a lot of stress on the heart. So a bad liver will put stress on the heart. And that's why if you have a liver problem, you should always sleep on your right side. So the heart sits on top of the liver, not so your liver sits on top of the heart. Stomach acids decrease with age. So a lot of people just need to tweak the they need to tweak their stomach acids, like with apple cider vinegar. That would be really, really important. Okay, so I just crammed a lot of data. I just want to take a little break here to see if there's any questions. Can you boil parsley? Yeah, you can for potassium. Yeah, it's really hard to kill the potassium if you heat it. I still drink apple cider vinegar, but it does give me heartburn, ironically. Well, that could be you need probably some more probiotics to start building up down here, because some people have something called gastritis. They have little inflammation that might not, they might need to kind of work on their bowels a bit more before they acidify the stomach. Because I had some people where apple cider vinegar didn't do well on them, and so we gave them the liquid probiotic, and they did really well on that. So that's how you can acidify your body. All right. Coconut water does have electrolytes. It's like the perfect electrolyte. It's just a little bit high in sugar if you're trying to lose weight. Baking soda is not good. I don't recommend baking soda. It's going to alkalize you. Okay. How much magnesium should I take? Well, guess what? I'm going to give you the download. In fact, I'm going to give it to you right now. Do you guys want the download? Well, we're not done yet, but I want to send you the download so you at least have, let me see if I can send it to everyone. I think this is it. Try that. And then I'm going to try to send the download to everyone. Let me see here. Tell me if you got it. And then what I'll do is I think I could send something in the chat. Let's see here. Yeah, here we go. Display sticky message. Yeah, I think that worked. Can you guys get it? So you'll be able to download the notes, because I'm covering a lot of information, and there's no way to go basically shortcut it, because there's just so much data. But I hope you see, so there's a pattern of things that are telling you to, hey, listen, you need to start eating better. Okay, I'm just going to just really quickly see if there's any questions, because I've been blabbing for a while. David said the cortisol support is awesome, helped me a lot. Thanks, Dave. It's really good for chronic burnt out people, basically. Okay. Okay, good. You're getting that. Awesome. Okay. All right, so let me just get right back into this, because I need to show you some other things. Here we go. Okay. So wheatgrass juice. A lot of you are already trying the wheatgrass juice powder. Wheatgrass juice is very interesting, because wheatgrass has tons of chlorophyll. The type of wheatgrass that I recommend is a wheatgrass juice powder, not a powder, just a wheatgrass powder. So it's way more concentrated. So 1 teaspoon is equivalent to about 6 to 10 shots of wheatgrass juice. That is so much magnesium, it's crazy. So this is a plant-based magnesium with all the trace minerals, with the B vitamins, with vitamin C, with potassium. So it's really good for the heart. And these are the other 2 things: anti-soft tissue calcium effect, vitamin K2. This is the MK7 version. That's the natural one. And then D3. My D3 comes in 10,000 IUs per pill. So that way It's just a 1-to-1 ratio to keep it simple. When people are taking this, some people even have a little more crust coming out of their inside their eye in the morning. That's calcium coming out, or tartar. They might have a little more tartar as it comes out. Sometimes it's less. But you want to take this until the inside of your bottom teeth is real smooth and no more calcium buildup. But tartar really comes from a K2 deficiency. So this is if you notice, I actually put a little bit of vitamin C, because vitamin C and vitamin K2 work together, and a lot of alfalfa, 300 milligrams. That gives you all the vitamin K2 complex nutrients all in one. So that way, you're not just taking K2, you're taking all 8 versions of K1. So that's a really cool benefit. Best source of magnesium, B vitamin C, and potassium. The chlorophyll. The only difference between our blood and magnesium is the mineral, magnesium versus iron. So magnesium is a real key thing that I think people don't get enough of, because it's in the leafy greens. So you want to get your minerals and your fat-soluble vitamins. This is the protocol that I recommend if you are using my products. Raw, organic wheatgrass, 1 to 2 teaspoons a day, 1 little scoopers. The D3, 4 in the morning with breakfast, 4 K2 in the morning with breakfast. Now this is if you have a problem. If you don't have a problem, then you can just take 1 to 1 and maintain it. So you can prevent a problem. But I'm talking about if you want to lower blood pressure and clean up the heart. Now, I always, at these webinars, give people a little break, a discount on things. And so if you wanted to get any of my products, I'm giving you a one-time offer that allows you to get a discount. So let me just pull it up right here. If I could find it. Yeah. So you would want to get that coupon code, and then you can use it one time within the next 25 hours, and you can get any wheatgrass, unless you already have it, or the K2, or whatever you want to get. And you order it up on my website, and then you could just click on put the code in, you get the discount, and then that way you can take something that is high quality. Now, the other thing is that one of the problems that people are taking with the K2 is they're taking the MK4 version. So I want to explain what MK4 version is. That is a synthetic version, and a lot of the studies have not come out yet on the long-term effects of taking that synthetically. I've experimented on myself and others, and I've not seen the results. So MK7 is the version that you would want from the K2. And if you're a vegetarian, and then you would take NATO. And my K2 is vegetarian. NATO is a non-GMO. The one I use is non-GMO fermented soy product from Japan. And there is a dish that you can consume. Personally, I think it's very disgusting, but it's filled with K2. And what happens, the K2 kind of goes into the body, and it starts to slowly extract calcium from the body. And when it pulls it out, it puts it into the bone, and it makes it really solid. So that's what K2 does. The other thing I wanted to mention is I wanted to just to kind of give you a little summary here. So this is calcium, this is potassium, magnesium, and sodium. Okay, so now let's take a look. So sodium is sea salt. Also, low sodium will actually cause low stomach acids. Sodium, if you're low sodium, it'll actually create dehydration. So potassium will lower the pulse rate. Do you remember what foods deplete potassium? Sugar. Do you remember what foods decrease vitamin B4? Refined grains. Bleached flour disease. And then you have E2, or a vitamin E complex. That's for angina. And refined flour products are another problem. And then we have potassium. How do you know if you're deficient in potassium? You're craving sweets. Sweet cravings means you're low on potassium. Plus, you need about 7 to 10 cups of vegetables per day. Honestly, I do 10 cups in one sitting. It's not that hard. You can blend it in a kale shake if you want. Potassium is also necessary for heart strength as well. So if you're feeling weak, you could be low in potassium. Calcium, most people get enough calcium very easily from a little bit of dairy and from the vegetables. So you can get calcium from your vegetables. But calcium needs to be absorbed in an acid medium. Calcium will cause high blood pressure. Calcium is involved in the clotting, or the formation of a clot. And you need K2 to lower calcium, and D3. Magnesium is in leafy greens and chlorophyll. Magnesium is good for heart rhythm problems like arrhythmias, atrial fibrillation. Also, angina. Vitamin E is high altitude oxygen. It gives you more oxygen so you can breathe better. And any cramps that you have, you can try vitamin E too. Vitamin E will make you stronger. People that are weak need vitamin E, especially the muscles. Now, what happens is that if you need some calcium, I recommend you get it from food, not from a supplement. And so you can have like a little bit of cheese, grass-fed cheese, things like that. But how do you know that you need calcium? If you have leg cramps or your toes are cramped. Okay. Let me just see if there's any quick questions. What about bananas? Bananas have 300 milligrams of potassium. You need 4,700. So how many bananas would you need? You need a lot. So we got blood pressure, high blood pressure. What are the things you have to take for high blood pressure? Magnesium, potassium, K2 and D3, right? Arrhythmias, you want magnesium, potassium are good. Now what about high pulse rate? What do you take for that? Potassium. See, the hardest nutrients to get is potassium. Potassium, because you need so much. Magnesium, an average diet is low in magnesium as well, but not as much as potassium. So mainly we're deficient in potassium and magnesium as our main thing in K2. We're high usually in sodium, we're really high in calcium. And that's why we have the problems. Okay, good. So I just want to see if there's any questions. So someone says, I wrote to you in 2000 to tell you about success after your program. Oh, wow. Well, I'll tell you what, Leanda, just ask for me when you call in the office, okay? And I'll if you have a question, I'll be more than happy to talk to you. But awesome about getting the success. I want to actually get your success story. Now, as far as a pacemaker goes, you have 3 pacemakers in the heart. If you already had a pacemaker put in, you have an artificial pacemaker. It's really, you still want the nutrition, but you might want to, you're not going to be able to obviously fix that because it's being artificially synchronized in the beat. My father has a pacemaker, and it's interesting that he lost all of his teeth. Like, what's up with that? So I know he was deficient in the K2. I know his diet wasn't that great. But the point is that if you can start out your kids, your grandkids, with these nutrients, with the electrolytes, with the diet, with the K2, they won't have all these problems like we do. Okay, some other people are asking, can you ship to Europe? Yes, we can ship to Europe. You'd have to just email us so we can tell you the specific cost of that. We're planning to come to your clinic to fly. How long do I stay in town? Well, we could find out based on what kind of problems you have. You could just call us. There's a hotel down the street. A lot of times people stay for a few days to a week, and then we work on you. Let's see here. Wow, your cholesterol is 110. I think that's fine. I don't think that's the problem. Okay. Anxiety, panic attacks cause arrhythmias. Yes, I need to cover that because stress. We didn't even talk about stress. So let me just kind of cover that real fast, and I'm going to end off because I promised 1 hour. The adrenal glands back up the heart rate. The adrenal glands produce adrenaline, cortisol, and those severely keep you up at night to prevent the sleeping, and they also create a lot of stress in the heart. If you're not sleeping, your heart's going to suffer bad. So there's a new adrenal thing I have. It's called a vegan formula. It's called Adrenal Night Formula. It's a 30-day supply. That is a little bit stronger than the other one I had, and that's what I would use for sleep if you can't sleep. If you sleep, your stress goes down. If you can't sleep, the stress goes up. But over years of constant stress, that can really burn your heart out. And so you're going to have to support the adrenal glands, because when you lose the function of the adrenal glands, your coronary starts tightening up and you get angina. That's why people like stress-induced heart attacks. So you're going to have to work on that with your adrenals. So there's a lot more to cover about with the nervous system connection with the heart, but I wanted to give you a quick summary of the nutrition connection to the heart. Did you guys learn something that you never knew before? And did you enjoy the education that you got? Of course, there's a delay. Someone says, give me the, they need the code again. Let me just give you that code. Okay. How about right here? Here's the code. Let me see if I could put it over here. This is the code that you would type in or just save it, and you can use it as a one-time thing to get a discount on my website, which, by the way, I just upgraded, so I made it a little bit cleaner to look at, but it's the same information. So anyway, I want to thank you guys because you're giving me, I'm glad that you're enjoying it. I'm so glad that you got some great things out of this. I want to just kind of give you a summary of the heart, and I'm going to be doing more of these in the future. Thank you for sticking around this late. Unless you're in California, it's probably early. But I want to thank you, and definitely apply what we taught you tonight. And please send me your success stories and spread the word. And I'll see you in the next seminar, okay? All right, guys. Have a good one.